Okay guys, we start pathogenesis of ascites. Okay, ascites. First is retention of sodium and water. Okay, due to cirrhosis, accumulation of nitric oxide. Okay, nitric oxide cause splenic and peripheral atrial dilatation, decrease effective circulating of blood volume volume decrease, sense by kidney activate RAS system with secondary hyperaldosteronism, increase sympathetic activity and atrial natric hormone secretion. Okay, all these change lead to salt and water retention. And second is increase hydrostatic pressure in portal venous. Splenic vasodilation cause increased portal hypertension, increase hydrostatic pressure leading to oozing out blood from capillary to peritoneum. If both are present, okay, splenic vasodilation and increased portal hypertension cause also cause increased hydrostatic pressure, static pressure, oozing out oozing out fluid. Okay, third is hypoalbuminemia. Okay, decreased serum albumin in cirrhosis due to liver damage, decrease oncotic pressure due to decreased serum albumin, ascites occur. Okay, thank you for watching my lecture.